Cheers, Amy. Lovely. Cheers, bye.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
I've got an unconscious gentleman he has severe traumatic brain injury.
King's College Hospital, London.
I think something hurt.
One of the busiest A&E departments in the country.
They're a bit busy right now. Yeah, 50 minutes, 30 minutes.
King's is extreme, isn't it? Come on.
A place where love, life and death unfold every single day.
Fall from a tree. It's probably absolutely trolleyed.
I'm very drunk.
I just keep thinking, how am I going to cope?
All the patients you're about to see were treated in one department in just one 24-hour period.
Everyone should walk through an emergency room at least once in their life because it makes you realise what your priorities are. It's not the rush, rush, rush and the money, money, money. It's the people you love and the fact that 1 minute they might be there and 1 minute they might be gone.
King's College Hospital's A&E department sees on average 350 patients a day, 150 of them in minors.
I remember I got a massive splinter under my nail, and I thought, oh, I'll go out and get that cut out. And there was a notice that said minimum waiting time, and approximately 4.5 hours. And I thought, no, I don't think so.
What did you do then? Once you get the splinter out? Let it go bad?
Pulled it out, I think.
Did you?
Yeah.
At the moment, we've got about a 3-hour wait, and you've been here 2 hours, so it shouldn't be too long, because we've got lots of doctors around. Shouldn't be too long now. OK.
Okay, stay sitting up. Stay sitting up. Christian, sit up for a minute, yeah?
You know that old adage, it takes all sorts to make a world? Well, it takes all sorts in an A&E department as well. Right. So what happened to you?
Well, I was drilling a doll.
Yeah.
And because I pushed the whole thing, my drill went into here. I just pushed out the blood and then pushed them together and tried to...
Put the electrical tape on?
Yeah, because this was...
Yeah, no problem.
the closest thing.
You'll still find people that think, well, I'm only just nipping up the ladder, so, yeah, I'll hold a cup of tea, a drill and something round my neck with one sock on and a flip-flop.
Oh, it's stuck back.
Wow. I think you ought to have my job.
I did a really nice job.
What do you do for a living?
I'm a carpenter.
That is brilliant.
I was lucky because I don't hit my bone.
Yeah, yeah. They slip on the flip-flop, they spill the tea that scalds them, the drill goes through the head and they break a leg when they fall. They really think, oh, I shouldn't have really done that, should I? And you can feel all my fingers, you can feel my fingers. Yeah, what happened here?
Benzo.
Oh. Maybe you ought to come in and do my job. You're not doing very good on machinery, are you?
Oh, well. In Hungary, if you're a carpenter and you've got all your fingers, you're not a good one.
Oh, my God. People are stupid, aren't they?
OK.
There was a kid a few months ago and he'd been shot in the leg.
It's absolutely perfect in a minute.
Then it transpired he'd been trying to shoot the label off the back of his trainers or something ridiculous and had shot himself in the leg. What an idiot.
OK.
All right, thank you very much.
Take care of yourself.
Bye.
Bye.
Is there anything you can't handle?
When people trap a finger and you get a blood clot, we have to put a hole through the nail to release the blood. I can't do it without sitting down because my ankles go. Can't do it. Awful.
that thing, isn't it? Hi, King Tony.
Adult red phone, 4 minutes.
In the morning, recess is really calm, the red phone goes, and you think, oh, I hope it's something interesting, which is an awful thing to say, an awful thing for the poor patient. But you do, you think, oh, I hope it's something I could do with something interesting today. Perk the day up a bit, pass an hour or two, make it go by quickly.
A construction worker has been trapped under a cherry picker, breaking his leg in several places and crushing his chest.
William, just take a nice big deep breath. That's pretty sore, is it?
Yeah.
Okay, mate, okay, mate. What out there?
No.
Okay.
No.
Not too bad. So it's all on that left side, isn't it? Have you got any pain in the leg here?
Not the whole leg of pain.
Just this whole leg, yeah? Basically, William, we've got to be really careful with you, I think, because you've had big forces involved. The pain that you've got and the tenderness that you've got in these different areas, we're going to need to basically do a scan of your chest and your tummy and your pelvic area there.
It's just give him some morphine before we...
Yeah, he's got the morphine coming, that's fine.
Say again? What we're going to do is just have a scan of your belly, all right, see if you've got any blood in your belly, all right?
Yeah, 5's good. Yeah, thanks, yep.
They're in a completely alien environment, you know, and they're in pain and they've got no idea what's happening. All they can see is the ceiling. They've got all these people talking around them. They've got, you know, they've got no idea what's going on, and it must be petrifying.
We might get scans all the way down, including his femur. I'll organise those. Is that the trauma radiologist? Hey, it's Graham Fleming here, one of the consultants in trauma and ED. There's a fella down here called William Slegg, who must be in his 30s. He's basically been crushed this morning between a cherry picker and a parked car. And during the mechanism, he somehow kind of fell, and he's managed to have his chest and his abdo and his pelvis all kind of crushed in this single motion. His whole body basically crushed between him and the back of a car. It sounds kind of odd, doesn't it?
Odd, but it sounds terribly lucky as well. I mean, given the...
What, that he's still with us?
Yes.
Yeah.
One of the saddest cases I ever saw was a man who got home. He smelt gas, so he rang up the gas people as an emergency, and then he hit autopilot. Autopilot for him was leaning against the wall with the phone under his ear, lighting a cigarette. He burnt his entire body except for the soles of his feet. And I recall even to this day the debate we had, because it was a non-survivable injury, but he was completely lucid. And his wife and daughter came to visit, and the question was, should we look him in the eye and tell him that he was going to die in the next 48 hours or so, and that there could be no treatment for him.
Those who are looking for eternal life, for the second coming of Christ, it's not as easy as some people have it. Most Christians, they are not following the commandment of God, and we will be judged by it.
You sure you don't want a flapjack? I'll sit up a bit, yeah? Sit up a bit. Can you put your hand there or not? Can you hold it on your nose?
I'm getting fed up sitting here.
Really be a long while these things take. You know that. You could be here all day doing this.
Do you know how long it will be for him?
Let me check. What's the surname again?
Stoked.
Okay.
Thank you.
first patient to be called.
Awesome, that's great. Do you want me to wake him up now or just wait till they come out?
Just listen out for his name.
Okay, I will. Thank you very much. Cheers. We went out quite late and someone tried to steal his wallet and his phone and punched him in the face. So we're like, he's got a cut across his nose, which he needs to stitch him. But he's a good guy as well. I wish like, it's bad that bad things happen to good people, but it happened. Yeah, I'd do anything for this guy. He's my best friend since we were little. So yeah, he's a good guy. Oh, is he gonna? Oh. Yeah, it was close, that one.
He said to me, like, you're lucky and unlucky.
Lucky what? That he didn't...
You're lucky that you didn't cut my artery.
Yeah, and unlucky in what?
But yeah, you still cut it.
Still cut it, yeah.
This morning, 39-year-old Darren was cleaning his windows when he fell through a pane of glass.
There's like a lot of the skin on the arm. It does.
You might have to have a skin graft if it's that bad.
I had to hold the skin back in. You know, it dropped like that and I had to push it in to hold it in.
Yeah.
She said, can you wrap a towel around it? But I thought, how can I with one arm?
Well, you just get a towel and...
She said, get a clean towel, she said.
Wrap around it, yeah.
I just pushed pressure on it like that.
What did you phone, 999?
Yeah. Well, I ain't going to phone you first, am I?
Well, your mum said, why don't you phone us? So, well, you panic, you phone and...
You have to, don't you, though?
Phone straight away, don't you?
He said, it's a lot of blood, he said.
Just cut the pints, I think.
You laughed, you didn't see it, did you? It's all up the carpet, it's all up the passage. All the blood was going everywhere, like, up the wall, on the carpet. Just pumping out, it's like drinking tap. It's like fingerprints on the walls.
Oh, we'll have to have it redecorating then.
Yeah, like drip, drip, drip. You know, say it's the foot, it goes psh, psh, like that.
William's X-ray results have not yet returned.
William, your girlfriend's here. Do you want us to come in?
But doctors have decided that his injuries are not life-threatening.
We need to keep him strapped down like this. No, he's fine. This is all just precautionary, all right? You sit as you are. Let's get you a chair. Want to come round this side? Come round this side. I lower the bed. All right.
How are you feeling anyway?
Great. I just broke all my ribs and my leg.
So what happened? Basically, you carry some stuff or something?
No. Sorry, I'm grumpy because I'm angry. We have the cherry picker, the big blue machine. You know the big blue one that can go up to the roof and down?
Yeah.
And the wheels are the same size as tractor wheels. So I had to try and stop the traffic.
Okay.
But at the bottom of the road there was a car there. Driver!
What? I can't hear. Don't worry.
I thought I was dead. I went underneath and it went all over me.
With the car, I don't get it.
Stop being stupid and listen.
Yeah, listen.
Imagine a tractor is here.
Okay.
A car is here. And I'm standing behind the car in front of the cherry picker so that I can then stop the traffic.
Okay.
The big
tractor.
Imagine how much weight.
Yeah, I can imagine.
First, my leg cracked 3 times. From my ankle to my knee, and I'm shouting, stop!
Shush.
And then my ribs and my body went underneath. I was dead.
No, you're cool. See, you have someone up there who looks after you. You're Superman.
But I heard everything crack as well. 3 cracks in my leg and ankle.
There are some very strange things that happen to people that are not their fault. We had a poor man in where a tyre that he was fixing exploded and unfortunately severely damaged his cervical spine. If you're stuck between 2 huge lumps of metal and those 2 lumps move together and you get away with it, well, that's something to hold on to, isn't it?
I've had a lot of accidents and injuries in my life, but this is the most scary.
This is serious.
This was the most scariest, 'cause he could...
Typical when everything goes quite well. Something like this happens,
Love you.
Love you, love you, love you, love you.
Love you more. More.
Love you. See you in a bit. I've got to go, Mum. Okay. I'll call you in a second. Okay. Love you too. Bye. Alex, it's time to wake up. Come on, man. Let's get up.
Alex has been mugged and punched in the face. His old school friend Patrick is on hand to help.
Doctor's room. Alex, no swearing, man. There's people around. Don't swear. Come on. Oh, shit.
I think it must have been about 12 or 13 when we first met. No, yeah, he's a chatty bloke and just wanted to be my friend from the beginning, so...
We've been waiting. We've been here fucking ages. Alex, don't get angry at me. This way, not that way. Come on, this way.
I thought he was a bit of a loser when I first met him, but...
Take my hand. It's good. Sorry.
Wait, shut up. Get.
I'm not on you. Can I come with him? Is that all right? Awesome.
He's one of these guys who's always quite sentimental, if you know what I mean. He likes to... Well, I was going to say show his affection, but that sounds gay as well. But no, he's a top lad. Yeah, he's a nice guy.
Do you want me to push it? He's absolutely massive. I'll push it. It's good. Oh no, honestly, here, there you go. He's an absolute tank.
I didn't want to go to the hospital straight away, but Pat was like, you need to get it sorted out, because otherwise you're going to be left with a scar. You know, Pat was busy, I'd say, really. He didn't have to go and take me. They could have been a thing, but...
what do you mean he was busy?
Well, he was with some girl that he just met at the club, and he didn't tell you about this, did he? He didn't want me to say anything, but...
Al, you gotta get up, man. What? Alex, no swearing, man. We're in hospital. Would you tell me to shut up? Yeah. You never say that shit to me. We're best mates. You'd be stupid. You swear at me. It's awful. Oh, can I put this somewhere?
Yeah, I'll get you that.
Oh, thanks, man. That's awesome. I'm tired, man. This shit's fine. Mate, you just gotta stay awake for like 15 minutes, just talk to her, yeah? It'll be alright. I've got a feeling this might hurt you a little bit, so...
I do like abscesses. I like draining abscesses and squeezing out all the pus. I know that sounds really horrible, and some of them can be really smelly as well, but it's almost like a sense of achievement. You've got this huge sort of pulsating swelling that's full of bad stuff, and that knife goes in and whoosh, all the pus comes out, and it's just like, I don't know, it's almost like a eureka moment.
When you touch it around here, man.
All right, okay.
You see when I touch it like that?
Is that painful, yeah?
Yes, man, yeah.
Okay,
It's like someone's whacked me with a hammer.
Okay.
It's really hurting me, man.
Okay. I think he's got Achilles rupture, actually. I feel like I thought I felt like a gap.
I don't even know who you're talking about, so...
Sorry. Yes, thank you.
I might have to be on crutches. They said I can't walk on it, man. It's making it worse, So me have to style it with the crutches, man. All right, just meet me, man. Hurry up, my man. Go. I want to go home, man.
because I'm what they ordered. I'll get the portion. Hello, Andre. Lovely, I'll get that. I'll get. Oh, Carol! Oh no!
Hey, Ginger, see Oh, I've got to go off now. No.
Oh, Carol, sorry. I hit her on the head with the door.
Today, when we go home.
No, you're
from
not
the
gonna
car
go
park.
home today. You're gonna stay for a few days, I'm afraid.
No.
Seriously, you have to stay a few days, darling.
Seriously? Why?
Stop being silly.
Can't they just plaster it?
No, you're funny now.
How are you doing? Fine. You still got some pain, haven't you? Yeah. So we're going to give you some more intravenous. And if the X-ray confirms the clinical suspicion that you've got a broken leg, the issue will be what needs to be done and when it needs to be done.
They'll be staying here today.
Oh yes. I would say to you, even if you hadn't broken your leg, you need to be with us for pain relief. You've already had 25 milligrams of morphine, which is a good dose. You wouldn't really want to go home with a paracetamol and aspirin, would you?
No way. Am I allowed to drink any water?
I give you again the
We have to
sponge.
wait until we get the films and we see how your leg goes. So we'll get an answer for you hopefully in the next hour or two.
Thank you very much.
I've got Wagamama's face. Wagamama's.
You got what?
Wagamama. Well, I've still got a big crisp one left here from last night. You didn't know them still were left here.
So what's this all about then? You've been a hero.
Yeah, genuine.
A genuine hero. Don't see many of those. What happened?
It's standard for me, though.
Oh, you're one of those, are you?
Modest.
One of the great heroes of our time.
Alex, I love the story. Come on, tell it.
Come on. How? How did you save a woman's life?
You were on the train station. You were on the platform. What happened?
Fell onto the tracks, smashed back.
Fell onto the tracks. Oh my God, that's really scary.
Freaking out.
Oh my God. So you didn't jump on the tracks, did you?
Someone had to.
Oh my God.
Some people say she's being electrocuted. I was
Come
like,
this way a bit, sweetheart. All right, this is going to sting a little bit.
I'm just saying.
I imagine he saw someone in danger, thought, whatever, I'm going to sort this out, and just got in the way and did it. It's impressive. I know a lot of people aren't like that, so that's cool.
So you jumped onto the tracks?
Yeah, I just stopped the train.
You stopped the train? How did you stop the train?
With my bare hands.
Oh no, come on, right, okay, I don't believe that one.
Like Superman or Hancock.
So, yeah, sorry. Go on, keep talking, because I want to distract you from the pain.
Yeah.
The hero story. Well, yeah, I spent a while after that happened telling that story quite a lot, to be honest. You know, to impress the ladies and stuff like that. I think I've ended up exaggerating it so much that I don't even know what's true anymore.
I mean, does she know that you saved her?
No, well,
No.
before she didn't. When we left, she was being brought to an ambulance.
I mean, that is pretty amazing. That is something to tell the grandchildren, isn't it?
Is it painful, Alex?
Not really.
Well, you're a hero, aren't you?
Yeah.
Is that a bit stinging? All right, that's the last one, sweetheart. All right.
I'm not a player like Patrick is, though. He's a bit of a ladies' man these days. He got a threesome the other day.
Alex, do you want a photograph or not?
He claims that he didn't even have to do anything. They came onto him. I was like, what the fuck? With that hat on? What the hell?
I hope that's not good.
Did you see my two guys that I had in there? The one that I was suturing his nose, somebody had an epileptic fit on the train station, fell onto the tracks, and he jumped down onto the tracks and saved her. That's amazing, isn't it? What a hero. Yeah.
So what happened to him this time?
Somebody's headbutted him.
Are all the trauma team here for you?
Yes.
Yes. Thank you. Thank you.
Can I have some space, please?
An unidentified man has suffered a life-threatening head injury. Paramedics have given him the name Chris.
OK, if you could have quiet for handover, please.
OK, this is Chris. We think he's 50 years old. He had an unwitnessed fall from an unknown height from a ladder onto concrete. His injuries, he had a large occipital bulky hematoma with active arterial hemorrhage. He's got a traumatic brain injury and a query C-spine injury. He had clinical evidence of right posterior rib fractures.
Do we know how high the ladder was, although we don't
I said an unknown height. It's an unknown height.
No, I understand that, but what I'm getting at is that we don't know where he fell from the ladder, but...
No idea at all. I mean, the ladder was a large ladder to reach the top of the tree, maybe sort of 10 metres.
OK, but I mean, that just says the maximum height could have been 10 metres. OK, that's
possibly,
all. Fine.
Yeah.
OK.
Thank you.
Someone comes in with severe brain injuries and you know there is not going to be a good outcome, and you listen to the tragedy that led to it, and it's not good, but just get on with it. And the priorities are keeping the patient alive, keeping them safe. So the plan is primary survey. If we're happy with him from a cardiorespiratory standpoint, we're going to try and get him in and out of the scanner. Really trying to unlock this phone. Seriously, I want to ring radiology. This is...
Naomi, how do you unlock these things? Look. Where's
it's your mobile.
Do you know how to unlock a Nokia phone? This is my phone to get him into the CT scanner, and...
Should be the top and the corner. I'll get you these notes.
Is it unlocked? Why don't you just use my phone?
Well, no, because I don't know the number.
Oh.
Carol.
Has it come up? Right, let's find someone who can do.
I would say the greatest loss to a person would be their personality and their ability to think and retain information and to talk. So if you gave me the choice between losing one or two legs and my person being destroyed, then I would give up the legs. Yeah, hi, it's Decotac, trauma consultant. I've got an unconscious gentleman who's intubated, fall from an unknown height onto concrete. He clinically has severe traumatic brain injury. We need to scan him from head to pelvis, please. I don't think... Do we have a name yet?
Chris.
We're just waiting for a number and a name. He's an unknown male, approximately 50 years old.
When Nick first came in, he was, for some reason, known as Chris Unknown. I don't know where the Chris came from, so that was first we heard of it.
I just want to get the ball rolling so we know which scanner we're going to. OK, thanks. Bye.
It's a sort of story you read about the local paper. It happens to other people. That's the classic. It's a paragraph in the local paper, man falls off van, cracks head, goes to hospital, you think, plonker, and you read on.
OK, team, so from the top, Buzz, are you happy?
Yeah, tubes.
That's just for the gentleman down there, don't worry about that right now. We're not concerned about anything in the chest. OK. He's probably fallen onto that, hasn't he? I suspect it could actually be what's going on in his head that's causing that blood pressure.
There was peripheral damage, but clearly the head injury was all they were concerned about and what was very serious. He stressed from the word go that it was a very, very serious case. And you were left in no doubt that when we're talking serious, we're talking life and death. There was no doubt about that.
We need to keep a regular check on his pupils in case he blows one, in which case we need to then obviously hyperventilate him and give him some mannitol or hypertonic. Our aim is, if everything is stable, to get him in and out the scanner as quickly as possible. I've spoken to radiology.
And, 1 minute you're bouncing around on a Friday morning about to do something else, and the next minute you're in the casualty unit of a major hospital thinking your brother's about to die.
So what did you do about your...
It's kind of funny. I got to work this morning, sat down on my desk. Yeah, I just pushed my chair back to get up. And I just landed on the floor. You know what I mean? It wasn't a hard landing. It was, it was just like funny, and everyone was like laughing, And I was,
Taylor!
God, I felt this sharp pain. I'm like, my God, hope I haven't slipped a disc or something.
Okay, so you're in 2 hours.
Yeah. You still need your paper?
I do. I haven't read it yet, but go on, you need it more than I do.
No. If you haven't done it. Are you going on the train today?
It's all right. I'll go and get another one.
Oh, thanks.
Right, my name's Kim.
Right.
I'm one of the emergency nurse practitioners, and I'll be dealing with you today. So what's happened to your finger?
I was preparing a casserole to entertain some people tomorrow, and I was cutting vegetables last night and using what they call, I think, a mandolin cutter. You know those things? You probably have.
Yeah.
And unfortunately, I took a little piece out of my little finger.
Okay.
It's not desperate, but it
Okay, this is
produced a
last
lot
night.
of blood.
Oh, it will.
And this is after 10 o'clock last night, and I thought of coming down, and I thought, no, I'll manage. So in the end, I managed to stop it and bind it so it didn't, and put an oven glove on in bed, really.
Those mandolins are very, very sharp. Very good, but very sharp.
Yes, they're very quick, but I think it was a bit late at night, really, after 10 o'clock, and I was just beginning to think I would stop doing this, really.
And then you did.
And I did.
Okay, let me go and get a dressing pack, and we'll soak that and try and get that bit off and see what it's like underneath.
Okay.
All right?
Yep, that's
Give me
great.
2 seconds. Well, more than 2 seconds.
I thought, what a stupid thing to do, really, immediately, you know. How very stupid to allow yourself to do that. It's a very difficult position when you're living by yourself, you know. You've got no one to call upon. I've got used to it over the last 6 years or so, I suppose, but, you know, normally my wife or I would turn to one another and say, can you help me do this, or whatever.
You put cotton wool on it last night? I thought so.
Yeah.
But regrettably, she died in 2004.
I'm sorry about all that cotton wool.
That's all right. It's coming off.
Yeah.
I had to care for her for about 6 years. There's a gradual descent into a worse and worse condition until you get to the situation where she could no longer live at home. She had to live in a home, of course, for the last year or so of her life.
Oh, yes, you're adept at it. So I can't go
All
and
paper
shower
material.
with this.
No, put a glove on and tape it up.
I suppose that's the only answer, isn't it?
Yeah, another marigold.
Another one. Thank you very much indeed.
Take care.
Bye.
Okay, bye.
Caring is quite tough going, especially towards the latter part of it. And you stand by waiting for the next step where things will get worse.
I actually want to go with this gentleman to the scanner because I need to see the images of his head immediately. Because that will... What will happen is... He is, and I strongly suspect that it's going to be not a happy story.
Both my mother and father, I ended up looking after to one degree or another. But this was different again. This was another story. I think my biggest concern was the cabbage option. And there's no doubt there's that scenario where you are better off gone and finished than just in a total mess. I think that's a worse nightmare than being dead. Would be for me, I know that for a fact.
Hello.
Hi.
Right. Can I just eject you from your seat? Thank you very much. I'm Nancy, I'm one of the nurse practitioners. So what has happened?
I slipped or cleaned the window, and as I slipped, I put my arm through it.
You were cleaning the window?
Yeah, and I leant forward, and as I leant, I lost my balance on the seat, and my arm went on it, cracked the glass and went through.
Oh dear. Did it completely shatter?
Yeah, there's still like sharp pieces stuck in the frame of the glass of the window, that's it.
Oh goodness me. I think probably what I want to do before I look at all of the wounds is actually send you for an X-ray to see if there's any glass. What I do want to do is just remove that little bit of glass off your face because I can see it there.
Okay.
All right, you just close your eyes for me.
Quite honest, I never thought he'd have it in him to go to the phone like that and actually phone 999. He had a bad accident years ago, which was... But to see another one, and then you think to yourself, oh, no, not again, please.
OK, that's that. OK. All right, if I show you where to go for your X-ray. Yeah. All right.
When he was about 14, 15, I believe. It's such a freak accident, it's unbelievable. Basically, this moped come from the other side of the road, and brake handle thing caught his lapel and went into his lapel and threw him up in the air, and he come down on the back of his head and fractured his skull. Freak accident, really. The bike didn't actually hit him.
All right, and I'll see you when you get back.
All right.
OK.
I thought at the time he wasn't going to pull through because he was OK in the ambulance, but when he got to the hospital, he passed out. Pretty horrific, pretty frightening.
Like saying about X-ray. That way, look, X-ray. Is it that way?
Through having that brain injury, a lot of brain cells died. And who knows what he could have been today, you don't know. So obviously, I feel a bit aggrieved about that after all these years still, but thankfully he's still here. You know, you have a brain injury or you have a head injury like that, it could have been a lot worse.
After an operation on his brain, Nicholas was brought out of his induced coma. The full extent of his injuries is not yet known.
We're going in favourites. Cricket starts on Wednesday. First test at Brisbane. And we're starting as favourites. Won all the warm-up games. Not sure that's a good thing. Whereas we didn't know whether or not he's hearing anything, you could look at those eyes and know absolutely 100% they weren't seeing anything. Or if they were seeing anything, that they didn't understand anything they were seeing. Right, I think you're better off resting, sunshine. Yeah. You hear my voice? And again, it invoked the worries of what are we going to end up with here? I mean, we've got a massive problem in the modern world with people living beyond their not just enjoyable life, but their useful life, their meaningful life. I don't know how to... we are keeping alive people that just really are better off not here. OK, mate. I'll see you in a couple of days. A bit more progress. Yep. All right. See you in a couple of days. Good luck.
Having looked at the X-ray, it looks like it's quite a big wound. So until I've actually taken all of the bandages down and seen exactly what I'm dealing with, I can't say exactly what I'm going to be doing with you.
Right.
All right.
I spent half my life in hospitals. If you only knew how many months of the year I've actually spent in hospitals with my kids being younger as well. I just want to get in and out. That's all I want to do. Yeah. So I've had my fair share of hospitals, I can tell you.
So let's take the bandages off and see what we've got.
I'd rather not look.
OK, that's fine. You don't have to look.
And, you know, it'd be just nice not to have to go to them. But unfortunately, that's what they're there for.
Yeah, I mean, there's lots of glass on the surface. All right, sorry, sweetheart. Oh, OK, so that is more your hand, isn't it?
Painful.
That's lovely. All right, I will need to put some local anaesthetic into the skin there because I really need to have a look deep inside, and I can't do that obviously because it's going to be a little bit too painful for you. That's going to be the worst bit. That's going to be the bit that stings.
Right.
And then after that, you're not going to feel anything.
All right.
All right.
When you say stings, what, bad?
It's not bad. It's, you know, it's bearable.
Yeah.
Yeah. OK, so this is the local anaesthetic.
Oh, not the other way.
All right, the hand will probably be the worst, so if we get that one out of the way first. All right. Sorry, sweetheart. All right, take some nice deep breaths for me. Well done. You're doing really well.
It wasn't that bad as I thought it was.
There you go, you see.
Yeah.
Often it is the expectation that's the worst thing, isn't it?
The thought of it is worse.
Yeah. And what I need to do, I just need to have a good look underneath this flap, all right, and see what's occurring. So there's no tendons visible.
Right.
All right, that's the important thing.
Yeah.
So I'm going to give it a good clean.
Yeah.
And stitch it back up.
Okay.
But there's no major damage done there.
Ooh.
Can you still feel that?
Yeah.
Is that really painful?
A bit, yeah.
Do you want some more anaesthetic in there?
Bit, maybe, yeah.
Yeah?
Yeah, you do worry over these things, you know, you just... if you're worried about it every day of the year, you know, you put yourself in a box, really, worrying about it all, but you have to take life. Life has to go on, doesn't it? You know, whatever accidents you have to sort of move on from that, and otherwise, you know, if you just keep thinking about it all the time, it plays on your mind all the time, it sends you mad as well, so you have to move forward.
Hello. Yeah, 3 cracked ribs, broken my leg in 3 places. Look, how can it be my fault? Yes, they did. Yeah, they did.
Oh, your collar's off. Yay.
Yeah, collar's off.
Bye-bye, take care.
Thank you.
Any worries, come back and see us.
Thank you, thanks a lot.
I just think it's not very wise to stand on a chair with socks on because you can slip. Should have used a ladder properly, like a step ladder, you know, for more support. So I think it was a bit silly, really.
You play the cards that are dealt you, and it's you get on with it. You don't run away from it, and yeah, you don't feel sorry for yourself, and you just do your best. Had a motto at the time: hope for the best, prepare for the worst, which is what we started doing, and you know, hoping for the best won out.
You just don't think that it's going to happen. If it happens to someone else. The fact that I'm walking, talking, and getting around is fantastic.
Kings, without doubt, yeah, gave my brother back to me, and you know, you're just lost in admiration when you walk into that intensive care unit. You just feel stupid.
Has he told you he loves you?
No. No, we're not that close.
Hello, King's Emergency Department. Stuart, I actually think you're having a heart attack as we speak. David, can you stick some oxygen on? What? This.
Oh, it's
Just taking
the pain of it.
I'm going to be blunt, and I'm going to say this patient is going to die if he does not get critical care input.
That's the real bottom line, isn't it? Am I going to live or am I going to die?
He's looking at you, kid.
Here's looking at you.
King's only. Lovely. Cheers, bye.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
I've got an unconscious gentleman he has severe traumatic brain injury.
King's College Hospital, London.
I think something hurt.
One of the busiest A&E departments in the country.
They're a bit busy right now. Yeah, 50 minutes, 30 minutes.
King's is extreme, isn't it? Come on.
A place where love, life, and death unfold every single day.
Fall from a tree. It's probably absolutely trolleyed.
I'm very drunk.
I just keep thinking, how am I going to cope?
All the patients you're about to see were treated in one department in just one 24-hour period.
Kevino! Everyone should walk through an emergency room at least once in their life, because it makes you realise what your priorities are. It's not the rush, rush, rush and the money, money, money. It's the people you love and the fact that 1 minute they might be there and 1 minute they might be gone.
Where's our bit of paper? Hello, King's Emergency Department. 6 minutes, 120. Lovely, thanks very much. Cheers out, bye.
Red phone, 6 minutes. Red phone, 6 minutes.
You are jesting.
Lovely, thanks.
How many minutes? How many minutes?
Second red phone, 12 minutes. Second red phone, 12 minutes.
Can I have a receptionist to reassess the booking the red phone, please?
Stuart is 59 and has a history of heart problems.
Apart from the heart stuff, any other medical problems?
Leaf drops.
Okay. And what medications are you on for the heart? Are you on anything? Bisoprolol. Yes, hi there, it's Firas, one of the A&E consultants. I've just seen a 59-year-old gentleman who came in as a priority call. Okay.
Consultant Firas has worked in King's emergency department for a year.
So filling defect in the SMA. Okay. It's a bit cliched, but yes, I have always wanted to be a doctor. Ever since I had my tonsils out at the age of 5, my parents bought me a Fisher-Price doctor's kit as a reward. And ever since, the only thing I can ever remember wanting to be was a doctor. Okay, lovely. Thank you very much. Bye now. Guys, cath lab. Stuart, I actually think you're having a heart attack as we speak. David, can you stick some oxygen on? Some high flow. Yeah. I think that's the pain that you've had, and I think we need to just get you straight up to have another angiogram. Okay. So nothing to worry about. I think we've caught things in time. Okay. have some patients that it's obvious what's going on, you've seen it so many times before. And then there's other times where, well, you really don't know what's going on, and it's almost... You're not gambling, but you're playing the odds. You're thinking, what's the most likely diagnosis?
I'm one of the doctors. And what's your name? Is it Reg? Reginald. And what's your surname, Reginald?
78-year-old Reginald is a retired dock worker from South London.
You've been feeling well up until today?
Yeah.
No cough, no fevers?
He woke up this morning with severe stomach pain. Reginald also suffers from diabetes.
Okay. And you've taken your insulin today?
Oh, the left side is terrible.
Is it? You feel dry? Can I see your tongue? Yeah, you look quite dry.
Yeah.
Do you know where you are right now?
No.
Do you know roughly where we are?
No.
Do you know what kind of building we're in?
Hospital.
That's it, we're at King's College Hospital.
King's.
Yeah, do you know what year it is?
8.
10. Do you know what day it is?
Tuesday.
Tuesday. It is Wednesday. Do you know, it's close though. All right, fine, just relax for a minute.
Obviously, I'm really junior and I try to give off this sense of calm aura. Even though inside myself I might be bricking it, I want the patient to feel calm, because if you look scared, they're not going to feel very comfortable, are they?
Oh, Jimmy! Get rid of me!
What? This?
Oh, it's
Just taking
pain, the pain of it.
your blood pressure?
Pain me off.
Okay, all right.
Oh.
Is that better?
Oh, yeah.
Yeah. All right, that feel okay?
No, he's a...
Good.
Don't let that happen again.
I'm sorry.
It's fear and excitement. You've got this person in front of you, they've just come in, and you're not really sure what's wrong with them. All you know is they're not well, and whether you don't know what's going on because your experience, because you can't get any access, you can't manage them, whether you just don't know what's going on, and you're scared of someone probably just dying under your care. I think that's what you're scared of. But usually the fear kind of stops a second. It's like, I think you can probably equate it to performing. When I was like 9 years old, I played my cello. In my first solo, I was shaking, I was sweating. Then you got out onto the stage, and then you just played away, and you kind of get onto your rhythm, and it was really nice, and you're quite excited, and people clap afterwards. Obviously, people don't clap in A&E, but you kind of get into your flow.
No, we're not finished yet. We're just starting.
Thank you. Next, please.
Next, please. It's not Sainsbury's.
Let me have a little feel of his belly.
So we've got on 6 units.
And then we get him catheterised, see how much is in there.
Doing that.
You're going to make me feel better.
I'm going to do my best. We might make you feel a little bit worse before we make you feel a bit better, but we will make you feel better. I'm just going to lie you flat. I need to examine your tummy. I sort of quite like to stay distant from patients as far as possible. Well, sometimes things that are more interesting and you feel more passionate about, you get more involved. Sometimes any father-like figures, there's the potential to be emotionally attached to them, I guess. Do you feel that you need to pee?
I want to go wee, yeah.
You want to go wee? Maybe it's that that's agitating you. What we're going to do is pop a little tube into your bladder through your penis. Now, that sounds awful, but it'll make you feel much more comfortable, I promise. Cool.
Thanks very much.
That's all right.
Right.
Has he got full bladder?
Yeah.
A bit cold.
Oh. Hurry up. Oh.
Relax, nice deep breaths, well done. It's all
It
steady.
made me feel better.
This bit isn't nice. Hold my hand. Hold my hand. Hold my hand. Squeeze onto that.
Should be there soon.
Once this is in, I promise you, you'll feel better.
Oh.
I thought it was going to pour out.
Come on, where's all the nurses at, man?
There's one right there.
Ralph Bronstein. Hi.
Hi.
They look professional with their little pocket watches. I should have one of them.
You like uniforms, Rich?
Yeah, they're not bad.
Richard has twisted his knee moonwalking in a club. His younger brother Jake is keeping him company.
Jake is really, really shy around other people because he hasn't really experienced what I have, so I'm kind of just giving him the heads up. Basically, who I am to Jake is what my dad is to me.
Do you think people come to hospitals just to pick up girls?
No.
I think they do, man.
That's you.
Me? Me? Are you crazy? I don't come here purposely.
Yeah, you broke your knee on purpose to meet hot nurses.
Just go out and be like, oh yeah.
Yeah, just to meet hot nurses.
My dad is a really good role model. And for me to be a man and for me to do what men do, that's one thing that I need to turn into is a really good role model.
I'm gonna do the turn. It's like the 2-second look around. It's just like when you pretend to stretch your neck muscles and just have a little pee. She's doing her makeup, see? She's doing her makeup.
I've got some perfume if you want.
Reg, how are you doing now?
I feel terrible.
Yeah, okay.
I'll be honest with you.
Yeah, no, that's understandable. That catheter hasn't made a difference, has it? You still feel and look quite rubbish, don't you? Okay, okay. Yeah. Before my dad died, he was actually living abroad, so every time I would go out to visit him, he would introduce me to his university colleagues or his neighbours. This is my son, this is Dr. Firas. That's how he'd introduce me. And you could just see his eyes light up with pride. He was, yeah. I'm glad, out of everything, I'm glad that he saw me become a doctor. You know, I still remember his face at my graduation. I've got a photo with him. I think it's the only photo I've got in recent memory where he's actually smiling. It's nice. I've got that up in my study at home.
Bye.
Hiya. How are you? I'm leading, yes.
Fantastic. So everybody, he's 16 years of age. He was driving a motorcycle at speed, came off on a corner, no known loss of consciousness, moving all 4 limbs at scene and GCS 15 on our arrival. Injuries, he has bruising to both shoulders, abrasions.
Nurse. Nurse.
He's had no volume issues, been he's stable in transfer.
Lovely. Thank you very much. Jade, can you do the primary survey for me, please? Thank you. Hiya. Did you manage to catch that?
Yeah, I think I legged it in just. Came down. One of the anesthetic SHOs. I came down just.
big line in that arm for me and grab some blood? Oh, has he got 2 oranges? That's just neat. If you could just grab bloods from that arm for me, that'd be brilliant.
Down here, don't worry, just moving things around. Just pop this arm down to the side. Good man, that's excellent, and relax while I'm just doing this. I'm just going to have to do with your tummy. GCS is 15, equal react. Any pain there?
Reg, how are you doing? Lie you flat?
Yeah.
Have you got more pain? Have you just vomited?
Yeah. Oh. I don't know where my wife is.
Does she know that you're here?
Yeah.
Do you know if anyone's phoned his wife?
Well, LES said that they were following by car and they haven't come in yet. So shall I give her a quick phone call?
Yeah, if we've got a number, that would be brilliant.
Hi, is this Mrs. Brown? This is daughter. Hi, my name's Dominic. I'm one of the doctors at King's College Hospital.
It's getting worse. I'm really worried about him. He's had 5 litres of fluid and his lactate's going up.
Ooh. Hey, Reginald, I spoke to your daughter.
What, my wife and daughter?
Your daughter's going to come see you. Your wife's a bit too poorly to come see you at the moment, OK?
My wife's poorly.
Yeah.
Oh.
All right. OK.
Yeah, oh, thank you.
Doing well.
Did I tell you that I was seeing a gynecologist that works here? She hasn't contacted me back in ages, so obviously she's bored of me. Don't you know what a gynecologist is? It's girls that kind of look at other girls, Brazilians. They're kebab rolls. But yeah, they basically analyse stuff like that, just if there's any problems or any skin like deterioration or something like that.
Where is she?
I don't know where she is. So you're telling me there's no girls in school at all? Takes around 14, 15 now. When he needs advice or when he needs someone to speak to, I'm there. He's met a lot of girls that have come to see me and stuff. Like I think I've influenced that quite a lot, and he gets very competitive now. Like he's at that age where we can bring a girl home and give me the little wink and see catching up now. So it's good.
I will go home.
You go home?
Yes, I will.
What, to stare at her Facebook profile, Jake? Who? I don't know who she is until you tell me.
I don't.
Yeah, I think she's pretty hot.
What we're doing, sorry, I should have said, we're going to go up for a scan of your tummy.
I've done this.
I know you're not feeling very well. You're not very well, I know. I'm really sorry. And I know I promised that I'd make you better, and I know I haven't done that yet. Okay, but we're still doing our best. Now and again, a handful of times a year, I will get a patient where I will spend more time with them. In his case, I've spent, a good few hours with him, and he was the first person for, a good while that had got me that attached.
In bed.
What's Mum saying? Mum is so cheeky. If I'm in bed by the time you're finished, you're walking back. Yeah, right, woman. I put toothpaste up her nose again. I look at her trying to laugh as well. Why does she say laugh out loud? She's like 40 years old and she's trying to be the social mum.
You know that scares me.
You know, I deleted her off Facebook. She's liking every one of my statuses. I was like, yeah, that's it, Mum. You gotta go. You gotta go. My mum and dad are a couple that I look up to, but she's winning. She wears the trousers, and he knows that. Imagine getting her walking stick every day. Oh, if she gets old, I'm giving up. I'm leaving. My dad is a big part of my life. He gets up at 4 in the morning. He's back at 6 every day. He cooks and still has time to kind of show everybody that he's still kind of the father model. Like, he's there for us, and it's a big deal to me, because if I worked from 4 to 7, I'd walk straight up into my bed, order a takeaway and go sleep. But he doesn't do that, and I look up to that, because that's who I want to be one day, is the person who just supports his family, and he's amazing. He really is.
Reginald is suffering from a severe stomach complaint that doctors have yet to diagnose.
Thanks very much. Can I have a port display support for a ward transfer, please?
And you had tummy pain.
Just keep you on the oxygen. There we go.
So what's happening, Doc?
Well, we're just doing we're just waiting for the results of that scan you had, okay?
So the results of the scan.
Yeah, exactly. There's a few things that upset me. If you've got someone unwell, especially if it's someone that's previously completely fit and well, and the patient isn't getting better, I find that very difficult.
Oh, thanks.
So I've asked nurses to put an NG tube in.
Okay. That's really nice.
Okay.
Do you know something?
What's that?
In the 50s, I was in Egypt for 2 years. 2 years of Suez Canal.
What, in the army?
Yeah. And yes, here, this water, precious.
There must be a commodity out there at that time. I don't think anything's going to happen. You don't look any better, do you? I'm sorry about that. At one point, my father was working in Kuwait as a university lecturer. And my brother and myself were there visiting him for the summer. And this was in 1990. And I remember him disappearing one day at 6 a.m. and coming back. And he just said, "Boys, get up, look out the window." And we just saw smokes and tanks and all sorts. And he told us, "Oh, we've been invaded." And he was so, he didn't scare us. He was so positive, and he just turned it into this big adventure. I was only a teenager. I was 14. My brother was 9. My brother and I, as British citizens, we got evacuated through the British Embassy, but at the time my father didn't have a British passport, so they wouldn't evacuate him. And I remember getting onto the bus to be driven from Kuwait to Baghdad, and he's just said to us, "Chin up and cheer up." That's what he said to us, and whenever whenever my brother and I go through hardship, we'll just say to each other, "Chin up and cheer up." This gas is getting worse.
What?
Yeah. His lactate's gone up to 9.8.
Hello? Yeah, hello?
This man is going to die if they do not take him to theatre and explore. His lactates. The results of the CT was a bit ambiguous, but he had this really bad metabolic acidosis with this high lactate that was getting worse despite giving him all the treatment. His pulse rate was on the high side, he was getting more agitated and more drowsy, his belly was getting more tender. And I was that worried about him, I genuinely thought he was going to die in front of me, you know, there and then in resus. I'm gonna try and phone your daughter again and say that I am quite worried about you and try and get her to come in. I know she had an appointment, but I think it's quite important that she does come in. It's not just about him. It's about his loved ones. If my dad's about to die, as his son, I would want to know that that's going to happen. I actually missed the death of my dad. I would have liked to have been there at the end, and I missed out on that. So I think it's important for family to have that option if that's what they want. Hi there, can I speak to one of the relatives of Reginald Brown, please? No. Is that Reginald Brown's home? Can I speak to one of his relatives, please? No, I know he's out. Is that his wife or his daughter? Is it his wife? Hello there, I'm sorry to bother you. My name's Dr. Sadadine. I'm one of the A&E consultants at King's College Hospital. You knew that Reginald was with us, didn't you? I was wondering if anyone was coming up to visit him today at all. The reason I'm asking is that I'm actually quite concerned about his health at the moment. And I was wondering if his daughter was able to come up this afternoon, because I know that it'd be a little bit difficult for yourself. Right. Do you know if she has a mobile telephone number? Okay. Is there anyone that can bring you up to the hospital, Mrs. Brown? Okay. No, okay. When your daughter comes back, can you suggest to her that I recommend that she comes to visit the hospital? Okay. Right. Okay. All right then, no bother. Bye now. His wife was a bit vague. She said that she knew that her husband was in hospital, but wasn't very clear on why he was in hospital. And when I asked her if she was coming up, she told me that she couldn't come up. And then, as we gathered more information, it dawned upon me that I think that his wife had memory problems herself, and maybe even had dementia. And I suppose that heightened things a bit further. Reginald, hi. Yeah.
Okay.
I've just spoken to your wife to try and see if she was able to come up, but obviously she can't come up herself. And your daughter's out at the moment.
You want to keep me?
Yeah, we can't send you home like this, can we? We still haven't got to the bottom of what's going on. I'm worried that you have a little bit of an infection around your bowel.
Is there an infection, yeah?
But it's possible. It's possible. Do another gas. Is that like for you? Yep. Hello. Hi, it's Firas, A&E consultant. Did you happen to speak to your boss? Okay, I really need someone to come and review this patient, please. I'm going to be blunt, and I'm going to say this patient is going to die if he does not get critical care input. The lactate's gone up to 9.8 now. What might help is if someone comes and reviews the patient, and then you can discuss your findings with a consultant. So if someone could do that, that'd be brilliant. And I'm going to get a hold of the surgeons and the medics again. Thank you. I felt frustrated as things weren't going as I wanted, and I've got attached to him as well because he was stoical, he was friendly, and he was actually a genuinely nice guy. And it was worth taking the risk of taking him to theatre.
It's very black and white. We either do this, or if he decides not to do it, then he needs to be offered palliative care. But what's not the right thing, I mean, it's up to him, effectively. If we think he's competent.
Yeah. He will want everything that we can do done.
Good, and I think that's the right thing to do.
I think he's the main carer for his wife.
Right.
So I've spoken to her on the phone. She really doesn't seem to have a concept as to how seriously unwell he is. So I'm just I'll get on the phone again.
Yeah, I think
and try and re-emphasise that.
And he cares for his wife because he's physical, mental issues, or...
It might be that she has some mild dementia or something.
Yeah. Reginald being seen by our surgical colleagues who felt that what he needed to have done was to go to theatre and have an exploratory laparotomy, which is an operation where you open the guts up and you have a look and see what's going on, usually to find dead guts and remove it. And if you don't do that, you will die if you have dead gut within you.
Help you, I'm
Hi, Ms.
afraid.
Brown. My name's Andre Verkey. I'm the intensive care consultant. The scan shows that there's a problem in the tummy. This is not something that can be fixed medically. No, I'm sorry that it has to be like this today for you. There's a blockage in one of the blood vessels that supplies your gut. That's probably made part of the gut die. And without an operation, unfortunately, if gut dies, you are likely to follow, unless we can take that dead gut out.
Do you think that my boxing days is responsible for this?
No, I think this has got nothing to do with your boxing days. I think your boxing days have kept you pretty fit, so that you can put up with something like this. Because you're looking really pretty well to me for somebody who's as sick as you are. And I think, if anything, your boxing days have done you a favour. They certainly haven't caused this. But it's the sort of thing that, unless you have an operation, your life will be at risk. It's difficult to say to people you might die. You're telling them the worst news that they can possibly hear. And you just walking in there and you having this conversation straight off. Never met you, and I'm right into the most intimate part of your beliefs about what you want from your life. And let's face it, that's the real bottom line, isn't it? Am I going to live or am I going to die? All the rest is detail after that. I'm sorry to be so blunt about it, but I must give you real information to help your decision.
I'm in the hospital. I'm sorry, I'll find I've got something.
This is something serious, though, and something that we have to act on. It's not something that, we can wait and think about and try some other things.
You've made it emergency, haven't you?
It's a real emergency.
Yeah.
So I think my view is that an operation is the right thing to do. So of course no one particularly wants to have an operation at short notice, but it is the only way. The likelihood, unfortunately, is that if you chose not to have an operation, and it remains your choice, you would die. If Reginald had decided, on balance, I don't want that operation. I'm of sound mind and, I don't want it, and I don't need to explain to you why I don't want it. That's okay. That's up to him. Our primary ethical duty to patients is to respect their autonomy in making decisions about that kind of thing. But if you don't give people the facts, they can't make decisions. And you've got to give the facts as best you understand them at the time. And you've got to be honest about it, in my view.
Is it a big operation?
It is a big operation. I must tell you, it is a big operation, and it will carry risk. It's naive to say it doesn't carry risk. It's a big operation, it does carry risk. But compared to your risk of dying without it, that risk pales into insignificance, in my view. All right. We'll do everything we can for you.
When will this happen?
It'll happen today.
Today?
This afternoon.
I don't even know what bloody day it is.
I forget as well sometimes. It's Wednesday, as it happens. Okay. All right. Okay.
He's looking at you, kid.
I beg your pardon? He's looking at you, kid.
Humphrey Bogart.
Humphrey Bogart. All right. Here's looking at you. I'll see you soon, Mr. Brown. All right. Okay. Thank you.
Swapped by a van driver up in London. She was lost consciousness, urine incontinence.
It's fatal with a lactate of north of 7 probably now.
Doctors suspect that some of Reginald's gut has died. If they're right, it must be removed immediately or he won't survive.
2 o'clock, he's still passing urine, still cerebrating, which means that he's made of stone stuff. So somebody's on a path that you've been involved in them setting off on, and there are a couple of things. I'm hoping that they're all right. I'm aware of the fact that they're coming back to my intensive care unit where I'm going to be looking after them, and you worry like hell, because you wanted to work hard for them. So Firat, he's I've spoken to him at some, and I've said I think it's the right thing to do. I think I did give him the option, and I said we can do it, and that carries a bit of risk, or we can not, but you'll almost certainly die. I mean, I really think it's the right thing.
Yeah.
You're happy to go, yeah?
It is hard when you see a strong man who suddenly becomes very vulnerable. I actually missed the death of my dad. And there's days where I think, I'm pleased I didn't see him weak and vulnerable, because I still remember him as being this, fabulous, strong man. And there's days that I think, I wish I was there so that he could have seen me in his last minutes and it would have provided him with some comfort.
I think Cheryl Cole needs to come to her senses and finally call me, man.
Too bad she won't. She thinks she
does. She needs me in her life. She'll realise it soon.
Yeah, like 20 years from now, she's so old and alone.
I don't care if she's about 90, as long as I say this
still
about
beat that.
Cheryl Cole. He could do anything he wanted to be. He's got a very big heart. He's creating his own path, and I like that a lot. If you believe in life, why not live it to its fullest extent? I don't see why people hesitate these days. You should appreciate every moment that you have, regardless of the situations, regardless of your past. You should just be happy and do what makes you happy, even if that's not going talking to girls all the time. Go out there and take risks. What's the harm? I'm not saying go and bungee jump off everywhere and do crazy things, but just go do what makes you happy.
Did I look good?
Richard Sales.
Oh, thank God for that.
Richard Sales?
Yeah. Come on. Oh, hello.
Hi, come on through.
How are you?
I'm good, thank you.
Good. Should be exciting.
Come on in and take a seat. Let me just sort this out.
Clean up a little. Oh. Little brother, yeah. He's all right.
Right. So what's happened today to bring you here?
Being under the influence, I've obviously slipped.
Right, okay.
My knee popped out of place.
Right. What have you done since? Have you rested it? Have you taken any painkillers?
No, I've taken painkillers here, but not at home. But then I just saw a nice girl and forgot about everything. Yeah. I'm joking.
You are terrible.
No.
Don't listen to this man, okay?
Oh, no, he's the guy who he is because of me, I hope.
You'll be the nice one that's like, yeah, don't bother with him. Go with his brother, he's lovely, all right? Just remember that. Everything he does, do opposite, and you'll have them flocking all over you.
Lovely.
We get a porter to ultrasound, please. Porter to ultrasound.
It went well, really well, yeah.
Did it?
It's good, yeah.
Good.
Thanks, yeah. How was the date last night?
Really? Oh, then we need gossip now.
No gossip, just, you know.
Are you looking for a second date, is the question?
Yes.
Good.
You're already booked for tonight. Are you wearing the same clothes as yesterday?
Jesus Christ.
I'm sure I did see you wearing that
I was wearing these
yesterday.
trousers, but not this shirt.
Yeah, but you're wearing those shoes, definitely.
Oh, different socks. Different socks.
First dates.
Oh no, it was good actually. It was really good. We met on a plane.
Really?
Yeah, that's pretty. Pretty love,
you ended up
actually,
sitting, you sat next to each other.
Any recess? Surgical register? Hi, have you just been with Reginald Brown? Okay. Okay. Firaz, the surgeon said they found nothing, they just open and close.
You are kidding me. You are kidding me.
After almost 3 hours, Reginald is out of surgery. Despite the doctor's worst fears, it turns out there was no dead gut to remove.
He's got a chance now. Yeah. My first reaction was overwhelming relief because I knew that that would be best for Mr. Brown. And actually, would I do anything different? No, because in that situation, the number one life-threatening diagnosis is ischemic bowel. But then also there's that little element of disappointment where you think, oh, I was bloody sure that was a bit of dead gut. We definitely did the right thing, and if I was in that situation again, I would do it again. Although we didn't find ischemic bowel during his surgery, if he had had it, he would have died, so it's something we needed to do so that we could discount that as a diagnosis. A lot of things in medicine are mysteries, so we don't always have the answers, unfortunately. If we did, then, well, we'd be very special.
The medical staff believe his original condition may have been caused by an accidental overdose of insulin brought on by the early stages of dementia. Reginald spent a further 3 weeks in hospital where he received more treatment for his diabetes.
I take one day at a time. My dad always says that. Day at a time. I'd be lucky to be here. If you make life what it is, you enjoy it. Oh, there's rough times, I know. But on the whole, my life has been a happy one. With the people I've been surrounded with the family, people outside my family. Wonderful days and wonderful times.
Could I get a doctor to resus to see the red phone that's here, please? Thank you.
If I can make a difference to a father-son, a father-daughter, husband-wife relationship, if I can give someone an extra 5 minutes, if I can give someone an extra several number of years, then that's a good feeling. You've always got to strive a little bit more.
Humphrey Bogart. Without that, I loved him. I think the reason being is that my father looked very much like him. I'm looking at my father now, very close to my dad. He was proud of me. And I thought a lot of my father. I loved him so much. What a man. Christ. I shouldn't be crying, should I? I'm crying because I'm happy. I loved him. What a man. He's looking at you, kid.
Adult trauma call, 5 minutes. Adult trauma call, 5 minutes.
When the ambulances just keep coming and lining up out the door, it's just dooms here.
Be all right.
Shut up! Chatting shit about where some stone microphone. Just shut up! You're annoying me, bro. You shut up! I've been here for 4 hours, yeah. I'm in pain.
What do you say to somebody who saved your life? You know, thank you seems very little.
King's only. Lovely. Cheers, bye.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
I've got an unconscious gentleman he has severe traumatic brain injury.
King's College Hospital, London.
I think something hurt.
One of the busiest A&E departments in the country.
They're a bit busy right now. Yeah, 50 minutes, 30 minutes.
King's is extreme, isn't it? Come on.
A place where love, life, and death unfold every single day.
Fall from a tree. It's probably absolutely trolleyed.
I'm very drunk.
I just keep thinking, how am I going to cope?
All the patients you're about to see were treated in one department in just one 24-hour period.
Kevino! Everyone should walk through an emergency room at least once in their life, because it makes you realise what your priorities are. It's not the rush, rush, rush and the money, money, money. It's the people you love and the fact that 1 minute they might be there and 1 minute they might be gone.
King's A&E has more than 200 permanent employees. Around 60 are non-medical. Staff who work behind the scenes to keep the department functioning 24 hours a day.
Good morning, King's A&E.
From porters to receptionists, cleaners to security guards.
So come away.
Finton McCarthy. I'm the ward clerk come support worker in the emergency department. Because he's saying that he wants a black top that had Adidas on it. Now, that one doesn't have Adidas on, but we have a black top here.
Finton oversees the stationery and clerical needs of the department.
Trainers there, Adidas.
He's also responsible for lost property.
I haven't had a good look, but yes. Oh, God. It's really, really heart-rending when you can't get property back to people. You take it home with you, unfortunately, you know, and it's upsetting. But that's the kind of thing where you've got it back to somebody and you see the smiles on their faces and they're happy to get it back. That's the best feeling in the world, yeah. Well, if this is not his and he comes down, you know, he's going to be really annoyed.
I know.
It is a very responsible job, I mean, because it's just a ward clerk job, but another aspect of it is keeping an eye on trolleys, because the trolleys that patients get wheeled around on will get broken and need to be repaired, and I have to report all those kind of repairs on trolleys. What's wrong with this one again? This bed?
That one, it ain't going up at all.
Won't go up and down, yeah? Okay. Sounds like a trivial little thing, but it's all important and it makes a difference. Excellent, thanks for that, Golden. Thanks, bye. Excellente. That's that sorted, that's that sorted.
Well, the cylinders have been done, I've ordered them. That's a good thing. Everything's going to plan. But I still don't like Mondays.
Ain't that bad, really, in here, considering it's a massive hospital, like for the...
It's only Monday, isn't it? Monday morning.
Yeah, normally it's packed, isn't it?
Yeah.
After the weekend things.
Yeah.
Isn't it?
Yeah. True.
Mondays are very busy. We don't use the Q-U-I-E-T word in the department, ever. As a little sort of superstition, we tend not to use that word, and everyone says, oh, don't use the Q word. Oh, no. Look.
Could Dr. Oliver please call 2398?
They're all jammed inside.
Majors, Jackie speaking. Basically, the emergency department is a 24-hour open front door. You can't control what comes through the front. The gates are always open.
Adult trauma red phone in 4 minutes. Adult trauma red phone in 4 minutes.
4 minutes? Yeah.
It's filling up though, isn't it? Yeah.
Sorry, Sharon. It's just number 5, love, please.
It can go from having just 3 patients to then, in the space of 20 minutes, those 3 patients turning into 7 patients. Because we have 1 red phone, which will be a stroke, 1 red phone that's a trauma, another red phone. So you've now got, you know, your numbers have doubled in an instant.
Adult trauma call, 5 minutes. Adult trauma call, 5 minutes.
Can we have a hand in here, please? Don't worry. Just relax.
Now, Kelly, we need to get this kid analgesied up. I have 8 patients in resus. We need something else, but I've got 8 patients and no room.
If we can't get people out of the emergency department, then we grind to a halt because there's only a certain number of trolleys on which you can assess patients. No worries. Thanks, bye.
Okay.
Ridiculous.
Fucking chatting shit about where some stone microphone. Just shut up, you're annoying me, bro. You shut up, man. Fuck. Hey, look, can you tell me what's happening here? Because I swear I'm starting going mad. Okay. The person's called me through to the X-ray. I go through there, yeah, and they're telling me, raw, no, go outside. I've been here for 4 hours, yeah. I'm in pain. What the fuck's going on?
No, wait. Let me just bring you down a step. You see what this says? You can't be talking to people like that. We're here to help you.
In resus, where the most seriously ill are treated, there are 5 bays, and they're filling up quickly.
Okay,
Lovely. All right.
Sometimes it can be a little bit soul-destroying. Feel like you can't see them anywhere because there's no space and they're not going out the other end. And when the ambulances just keep coming and lining up out the door, it's just that sense of not even impending doom, it's just doom's here. It's queuing up.
Frustration out with love. Frustration out with love. I'm taking the trauma bleep from 4 because Soph's got to go and there's a trauma arriving. When the newbies come on at 4, can we make sure at least 2 of them stay up here? Because we've kind of got a bit of a backlog now. Thanks, hun.
No, spit it out.
No, spit it out, spit it out.
Don't swallow it.
Oh, I really don't like sputum.
Oh, I swear. I'll do it again.
Have you finished?
Okay, deep breaths, keep breathing, keep breathing.
Adult trauma call, 15 minutes. Adult trauma call, 15 minutes.
It's getting beyond a joke now. Hey, is Jen? What was I going to say? Is there any beds coming up your end? When your bed comes up, can you just ring Resus? Because they've got one that's going to be an overnight stay, and I'm just going to fill you with overnight stays, if that's okay. Cheers, you shop. Bye.
Sometimes you just think, what am I going to do with all these patients?
There is no beds for people to go to, that's the problem.
At King's A&E, Monday is nearly always the busiest day of the week. It's late afternoon and the department is at capacity.
Yeah, Mondays are horrendous. I don't like Mondays.
Porter to Resus, please. Porter to Resus for an urgent transfer to CT. Thank you.
And very stressful.
We don't have CDU beds to keep these people. They're after, honestly, we don't. I mean, we've got no medical beds now.
At the end of the day, no one's gone to see their GP over the weekend because GPs are closed. So everything is quite slow and everything seems to just build up and no one goes anywhere till like 5, 6 o'clock in the evening.
Now, just like I did it there, I'm just going to go around the side, all right?
I'm not. Tell me when you're going around the side, and I'll tell you if I can feel it.
Okay, here.
Oh yeah.
Okay, I'm just gonna...
Oh, sugar lump! She didn't tell me you were.
Be all right.
I think we're trying to find some security.
Relax.
In Resus, all 5 bays are now full.
You just hope that a couple of people need to go to CT, so you can move the other people in there and do a full assessment and then move them out when the CT runs are done. Hopefully you might have one that needs to go to theatre straight away so you can get rid of another patient. It's just about managing them and trying to manage your space.
Can I just say though, Jeff, can I just say we in A&E are not all right at the moment. Because we're really not all right.
Whether they mean to or not, interactions can become a bit tense. I think everyone's, aware of how critical the situation is.
A&E Kings.
A call comes in from the London Ambulance Service. An 18-year-old has multiple stab wounds.
Oh, brilliant. Thanks so much. Bye.
His condition is critical.
Red phone, 8 minutes, please.
8 minutes?
Yeah.
Attacked outside a local shop, the stab victim has lost a life-threatening amount of blood.
Just lie on your back for me. Oh, you can't because you've got stab wounds on your back. I'm still getting a blood pressure of 66 over 29. 66 over 29 blood pressure.
Really?
Yeah. Pulse rate of 95. No drug allergies, no past medical history. Sorry, I'm just shouting at everybody because they're not listening to me. Do you know what happened tonight? Do you know where you got stabbed? No. Do you know? Where does that hurt? He's just examining your bottom, okay, where you've been stabbed in the bottom. 1, 2, 3. Oh, hold on a minute, there's a stab wound. There's one just here, I think, I'm not sure. Yeah, there is. There's a little shot. There's a small stab wound just underneath the armpit. And a large one. Yeah, and a nasty one just there. And one on this side as well. There's a nasty one on this side as well.
You've got to be able to change tack quickly because you have to cater almost for the worst case scenario all the time.
Can you do me a favour? Down there, just give me some gauze and a bandage because I've got 2 big open wounds here. I'm just stop the bleeding because it's bleeding and it's losing more blood. So go and get one of the A&E resus doctors to come and do a fast scan in here for me now, if you wouldn't mind.
I think the sample should be...
Can I get an urgent adult chest X-ray in resus, please? That's an urgent adult chest X-ray in Bay 4 in resus. Thank you.
You know, if it's a chest stabbing, you're going to get cardiothoracics down. If it's something with a really nasty, obvious brain type injury, you might ask for neurosurgeons to come down and be there at the time. So you're trying to coordinate people.
Guys, I've got a chest X-ray here. Do you want a chest X-ray more urgent than anything else, yeah? Okay, 1 second. What do you want? Yeah.
I think it's kind of like, you know, little ants running around all over the place because there are people madly trying to get their little thing that they've got to do organised. So the anaesthetist people, you know, anaesthetic people are checking all their airway kit. There's sort of this hive of activity.
Hold on a minute, hold on a minute. Hold on, I'm coming. What do you want? Yeah. I was just telling you, he's got an arterial bleeding in his bottom, it's blood all over, he's just losing blood, like. But he's had 3 units so far, Jen. They've done he's on his 3rd unit at the moment, he's got a 4th unit to go through, but he needs some FFP. Sharon was saying something about FFP or something?
Yeah, that should be with the code red blood.
I'm going to get you some more dressings, hold on a minute. Don't know his hospital number or name. No, that's not him.
If I look on here...
No. That's him.
He's got a picture in there.
Morphine. I know this is really horrible, DJ. Just try and lie there and just try and relax. I know it's really hard, mate. I don't think I'd be able to with all these people around.
It is stressful. It is stressful. You know, you're thinking on your toes. You're thinking, you know, all the time, oh my God. You know, and sometimes you think, this is really bad. But, you know, it's great. And then you save someone's life and it's absolutely amazing. There's no better feeling.
An hour after arriving, the stab victim's been stabilised.
Hello, mate. Is it all right if I just...
It's a bit kind of chaotic down here today, isn't it?
Yeah.
It's not your average Monday, is it?
Yeah.
It is? Monday's a bad day?
Mondays is a horrendous day. How's your pain at the moment, darling? All right. You let us know if it hurts, okay? And we'll get you something for it, all right? Yeah? Good lad.
sometimes you can somehow magically, and I couldn't write down how it actually happened afterwards, but somehow it all just works and it happens, and all of a sudden the patients disappear because they go to the right places or what have you. And so sometimes it's really rewarding because you sort of sit back and think, I don't know how, but we just made that work and we managed to do good for some people.
That's just the way it is. It can calm down in an instant. It would just be like a mill pond and nothing happened, and it would just be, you walk into resus and there won't be any patients, but you'll just see the carnage all over the floor.
I do see what's going on in resus and the blood and stuff, and because I kind of thought that although it's an emergency department, it'll be all the nurses and doctors that deal with everything, and I'll be removed from that. But I'm not.
Red phone 10 minutes, red phone 10 minutes. Thank you.
What we got then? What we got?
Collapse.
Query
86
calls.
collapse, 86-year-old collapse.
88-year-old Omar has been brought in by ambulance after suffering severe stomach pains. The ambulance crew suspect he has an abdominal aortic aneurysm, also known as a AAA.
Narrow pulse pressure. 87. Acute abdo pain, sweating, clammy. What do you think?
AAA.
AAA.
But not that tachy or hypotensive.
Not yet. Maybe it's about to burst.
We really went into the hospital kind of expecting that the medical staff will check him out and then say, well, you know, you've got a stomach bug or something like that and he'll get better.
One slide, ready, brace.
All right, sir. I'm going to sit you up.
Stick out your tongue.
Hello, hi, my name is Prem, one of the A&E doctor. Hi, I got a patient, he's an 87-year-old gentleman. Complained sudden onset of abdominal pain, severe abdo pain, and felt clammy and dizzy and weakness. His blood pressure on the right arm is 170/96 and left is 144/88, and also abdomen is very tender. My impression is look like AAA. I spoke to the vascular surgeon. He recommended to do the CT abdomen chest. So.
Was very, very bad, the pain. Over the years, we kind of got used to seeing him move from this healthy, strong, big man to something different, not quite the same as he was, not as healthy, always in pain.
Omar's scan confirms an abdominal aortic aneurysm. If he's not operated on immediately, he'll die. But his chances of surviving surgery are only 50%.
that's the situation. We'll run around and arrange things. We'll get into theatre as soon as we can. This is quite a safe environment where he's well monitored, okay? So probably he'll stay here and go directly from here to theatre when we're able to clear a space in theatre. I know they're currently doing another operation, okay, in pretty much all the theatres, including the emergency theatre. So that's the situation. We'll come back and speak to you as soon as we have more information.
Okay. Yeah, that's a very good point.
Sometimes they say, am I going to die? And you go, no. And you think, they can actually. That's horrible. But you can't not say no, can you? You couldn't say yes. Am I going to die? Yes, you are, actually. I do apologise for that. Of course you're going to say no. You're going to say no. We're going to do everything we can, mate. Don't worry about it.
Omar's evening started with stomach pains. Now he's facing life-saving surgery, but with only a 50% chance of survival.
All right, sir, well done. I'm going to give you something for the sickness, all right? OK? All right, fella. All right, well done.
I think touching somebody is one of the biggest things you can do when they're in a stressful environment.
Well done.
Could be all they need just to relax a little bit, because it is so scary. It's that touch, that warmth is important, I think.
All right. Any more, sir? Still feeling sick?
I have spent a couple of times holding someone's hands while they've taken their last breath.
You can't help but being moved by something like that. From the point of view of the seriousness of what's going on in their life and how you're sort of almost involved in their life. You're pulled into what's going on with them. It's silly, but I mean, it has an impact. You go in and it has an impact and you feel it. What is it? Who is she? The cat, what is it?
Who's she? The cat's mother?
Yeah, that's it, the cat's mother. I knew you were going to say that, yeah.
No. Who's her?
Her. If you just think about the stressful things all the time, it really can get to you. You have to sort of take a break and do something that you enjoy. I used to be a DJ, you know.
Did you really?
I did. Back in the 70s.
Honestly?
Honestly. I'm like a human jukebox.
Well, I could go sooner if you like.
Continue fine, I hope it may, and yet it rained but yesterday. Tomorrow it may pour again, I hear the country wants some rain. Let people say, I know not why that we shall have a warm July. Tomorrow it may pour again, I hear the country wants some rain. Let people say, I know not why that we shall have a warm July. Tomorrow it may pour again, I hear the country wants some rain. Let people say, I know not why that we shall have a warm July.
Are you on any medication for your fits or epilepsy?
Yes.
And what milligrams and how? When did you last take it? These are what I need to know.
This morning.
Yeah, this morning. And you take it once a day?
No, twice.
Twice a day. And you took
20-year-old Norman has epilepsy. He's admitted himself to King's after fitting repeatedly today.
Cool. So you take 600 and you sort of, right, cool.
That's what I'm talking about.
Can you get some PR diazepam from the fridge, please?
Okay. Has he got oxygen on? Yeah, he's got oxygen on. Has he got a line in?
Yeah.
Yeah.
It's very delicate.
Do we know what he's normally on, this boy?
It's one in a different language.
Sorry?
He's also on liquid.
So he's not on phenytoin? Not allergic to anything?
This drip is going to go any moment, man.
Hi, yeah, I'm just in spaghetti land. Just relax. That's it.
Oh.
Yes, NJ, you're fine. You're fine.
Well done. Well done.
You're fine.
NJ, no, you're okay. Stay still for me. We're just putting your drip back in. You're fine. You're okay. You're okay.
This is starting.
Just rest the arm for me.
We just need some tape and stuff because it just won't stick. NJ, just relax. You're fine. You're in the hospital. You're in the hospital. You've had a seizure.
Just relax.
Jesus.
If I hold his arm.
I got his arm. I got his arm. You bandage.
Me bandage.
I think you'll find most people who work in emergency departments, they like the variety and they like the thought that there's always some, I guess, adrenaline situation potentially around the corner where you've really got to have your wits about you.
So SATs are 100, blood pressure's coming.
I think it's just sitting here.
With the right medication, Norman's symptoms can be managed,
And we'll probably run another venous gas, hey? Why don't we?
but he'll suffer seizures for the rest of his life.
I'm tired.
Yeah, I'm
I had 8
tired
patients
too.
most of the day, night.
I'm tired too.
And I can't have 8 patients in here again. I might lose it.
All right, my dear, we're just going to get your son.
Omar's condition is deteriorating.
Don't jump off the bed.
Before he goes to theatre, his son has to sign consent forms to show he understands the operation is risky.
He was sort of kind of very powerless, and he had kind of given up and left everything to me. He just said, tell them to do whatever you think they want to do.
Yes.
Hi, my name is Mr. Ritter.
Hi.
Should we just sit down for a second?
Sure.
Basically, his main pipe in his body, the aorta, has blown. Yeah, it has rupture and it's bleeding. Okay. Now, without an operation, it's non-survivable. Yeah, it's certain death. So we had a look at his images, and we can do an operation for him, which is a minimal invasive operation, because an open operation he would
It's
not
not going
survive
to
either.
survive, yeah.
Okay. Now this is a life-saving procedure. Okay. The mortality rate with that procedure is about 50%. Okay. But if we don't do it, it's 100%. Okay. All right. Bottom line is, though, if we want to save his life, we need to do something. We need to do it now. Okay. And since his English is not very good and he's not in the best state, that's why I'm explaining it to you.
Okay.
All right. Yeah. Are you happy for us to go ahead with the operation?
I think so. There's really nothing else that we can do.
There's nothing else we can do now. We think he's got a chance to pull through, otherwise we would say, listen, that's not.
Being there completely on my own, I felt this huge sense of responsibility and loneliness at the same time. I mean, emotionally it was hard for me because, you know, if he didn't come through, it would have been me who signed the paper and let him go through all that.
So that, and you consented on his part. All right. Okay. Good.
Okay, well, I think I better call my mum. Hello. Well, it's not too good. It's got a Aneurysm. It's a blood vessel, one of those blood vessels that goes down from your heart. It's burst and it's bleeding a bit. So they have to take him in and operate and do a graft and sort of sort it out. Well, it's a risky operation, you know. If they don't do anything, you know, is going to die. If they're going to try and sort it out, but you know, it's a risky operation, so you know, 50-50. No.
I actually think it's sometimes harder for the relatives or the friends that are actually watching, because the patients sometimes are quite out of it. They're probably on painkillers and stuff, so their perception of actually what's going on around them, even though it might be scary, is probably not what you and I, who are completely stone cold sober, actually see of that situation, you know? And I think sometimes to spend a bit of time with the friend, the family or the partner or whatever is quite important, as well as spending time with the patient.
A 33-year-old man arrives in resus.
We just bung him in one while that one's in X-ray. Udo, keep him there for a minute. We've got one free for a second.
No other medical problems.
Hani has tried to kill himself. He's taken a lethal cocktail of drugs at his mum's house.
Mirtazapine, Penrindril, Quetiapine, citalopram, omeprazole, diazepam, temazepam.
And heroin.
And heroin.
We're not sure of the time.
It's very hard, very, very hard to see your child there, you know, and you don't know he's alive, dead.
Annie, we're just going to put a needle in your hand, OK? You need to keep nice and still for me. All right.
Do you want to turn him? Oh, stick this up his bottom. That's it, mate.
Oh, relax.
Bung his... He's clenching his butt cheeks. I can't get anything in there.
Hello.
Hello.
There we go. All right.
Do you want to try it your side? Come on, mate, lie down, would ya? Trying to help you, sunshine.
I went next door and he was unconscious. He was just lying across the bed, no cover over him, and he was freezing, he was so cold. He was icy cold. It was scary because I thought he was dead. It was literally like he was dead. I couldn't get him, wake him up or anything.
Hello. Hello. Wake up. Come on, talk to your mum a minute. She's worried about you. She needs to get home and get some rest, yeah?
I remember speaking with the nurse there. She seemed to understand as a, you know, she seemed to understand what I was feeling. She was just nice to me.
That's not on, is it?
She did understand, but she also was used to it, as she told me. She sees it every day.
All right, darling. All right.
It's not a new thing for them. They have overdoses in every day.
Hani tried to kill himself tonight.
I really, that night, I was 100% sincere in what I was doing. In every aspect that I can think of, I was at my lowest point, so I decided to put an end to my life. I took 1 whole week of medication at one time, and then I injected 1 gram of heroin and 1/2 gram of crack. And that took me to... and then I remember just waking up 4 days later in hospital, in intensive care. That's what had happened.
How are you doing, honey? Honey? Yeah? Open your eyes a bit more.
I think the first time I actually tried heroin and crack together, I was 18 and a half. The buzz was almost instantaneous. So within 30 seconds, you're on cloud 9, and I love that feeling.
Open your eyes again.
First time I realized it was a problem was when I had an overdose
Are you in pain
at
at all?
the age of 24, 25, and I went to hospital from a cardiac arrest.
Can you wake up a bit more, please?
Very quickly, I found my life becoming unmanageable. I left my wife, I left my children, I have no family. Basically, it's destroyed me in every single way. I have nothing, basically.
All right.
I just wanted it to end, you know. I was fed up. I was always thinking about my children. I don't know how my children look. That, you know, hurts me now. You know, I just wanted to go to sleep and that would be it. No more pain, no more anguish, no more drugs, no more people pointing the finger at you, no one judging you.
Can I have some tissues from behind there? Sorry.
Surgeons are ready to operate on Omar. He has a 50% chance of surviving the procedure.
It was like a finality. It was like as if that the last time I would see him alive. I think that's what I thought when I went in. And I don't think I've ever said to my father, I love you. And I don't think he's ever said it to me.
Geçecek birazdan. Terlediğinden. Hadi tamam baba, Allah yardımcın olsun.
I did feel that, you know, if it goes in now and it doesn't come through, I would never have said to him that I've loved him. I should have done. I was very hopeless. The only thing that really went through my head was negative thoughts, just that he's going to go through this, but he's not going to come through.
Just 1 minute.
If anyone in the department has paged the urology registrar, they are on the phone in resus. Please call extension 2398 or come to the phone. Thank you. It's the second time he's wrong.
Fierce tonight, eh?
I'm in a shitty mood.
What's wrong with you? What's wrong with you?
I'm tired, but I don't like being in a bad mood.
Well, you're working with me now.
So that's a reason to be in a bad mood. Sometimes it does feel a little bit like you're in a war zone. And I think, I'm just not sure how that didn't all go really pear-shaped, but somehow we manage. It's a team, and I can't do my job without the nurses or the porters and the techs. And that's one thing that I really love about emergency medicine. I like the fact that it's a community feel.
You know you've got to always wait.
My job puts everything in perspective. Very rarely can I not come home from a day at work and go, you know what, I've got nothing to worry about. It puts it all in perspective.
Honey, do you know where you are? Can you speak to me? Can you speak to me?
I'm just so glad that I never succeeded. You know, the hospital, the nurses, the doctors, I am grateful. They did save my life. Thank you is I don't know. What do you say to somebody who saved your life? You know, thank you seems very little.
Since he's getting better, have you told him that you love him?
No.
Don't you think you should?
I think he knows. I'm just like him, I guess. He wouldn't say it to me, and I couldn't say it to him. I don't know. It's just us, the way we are.
That's that thing, isn't it?
And what's made you come in this morning, then?
Nothing special.
Oh, God, can you just stop hurting, please? Just for a second, just be like, you know, be cool. Silly leg.
I just wanted to ask you, Duncan, what was your surname?
Fall from a tree, 25 foot. He's probably absolutely trolleyed, I'd imagine, if he's up a tree.